How would you rate your pain before you came and the day after the therapy, after the treatment?
Before it was 10, but now I say 2.
Good morning.
Hi.
Hello.
How are you? Nice to meet you.
Let's go in.
Hello.
Hi.
Yes, hi.
Irina.
Hi.
Nice meeting you.
Nice meeting you. Thank you for coming to the clinic.
Thank you for having me.
All right, so here this is the ANF clinic, and we are going to be helping you with the complaint that you might have it for, I think, for a few weeks, right?
Yes, it's been 5 weeks now.
5 weeks. All right. ANF therapy is an innovative technique. It's something new that I believe that you might have some questions about that. Do you want some explanation?
Please, yeah, because this is my first time.
Oh, excellent. All right, so ANF therapy is a technique, it's a therapy that works to reduce inflammation and many different types of pain. The ANF therapy works with the ANF tool, which is the ANF device. This device is a round shape we apply on the skin and is meant to distribute and stimulate your nervous system because it contains neurological frequencies. This is totally natural. There is no medication, no organic substances, only the frequencies that are in the device. So during the consultation, we are going to do an assessment, which is a physical examination. We will go through the different areas where you might have your complaint and to check the different tissues to see how much damage there is. During this examination, sometimes you can feel some discomfort and some pain, which is when we find the injury. So do not worry if you feel some pain, which is really normal, all right? Once that we find the inflammation, we will apply the ANF devices, creating a protocol consisting of different devices, and we will apply them on the skin, all right? During this process, the body will start eliminating inflammations, which is the main goal, but also toxins and other substances that should not be there in the body. So that's why maybe you have read in the patient information about detox symptoms. Yeah, so this is about that. Detox symptoms is when your body starts to eliminate these waste products, and then you're going to experience some of the common symptoms like a headache, dizziness, dry mouth. These symptoms can be mild and last only for 5 minutes, but other patients sometimes, depending on their toxicity or their sensitivity, they might feel a little bit more moderate or strong. But anyway, if you start feeling them now, we will wait a little bit with you. All right.
What I'm interested is to know how much pain do you have going up and how much pain do you have going down. You portfolio can go in here and do as the whole study.
I'll go on and listen to the lip, which usually I do steps on 2x2s for exercise.
Yes.
I cannot. So this is what I can do, is I help myself going up because I cannot press on my neck. So I have to do this. And coming down, this is what I do. Right, this one.
All right. Okay, so and I believe it was also swollen, and it was also swollen 5 weeks ago. It was more.
More swelling. It was more swelling. Right.
All right, and especially on this side of the
Yes.
knee. I'm gonna start palpating like very, very slowly on the area. First, I will make sure that the lamp is moving. Just let me know if you feel any type of pain, right? Okay, this is one of the, yeah. Okay, so how much pain do you have when I palpate?
That's, I would say 9.
Okay. This is the upper part of the tendon. I'm gonna move to the from the tendon a little bit lower to see if there is also, right? How much pain do you
This
see?
is the same thing.
And I will go to the lower part of the tendon.
Yeah, that's
Also
same
same.
thing.
And
Yeah.
so this is one of the tendons, an important tendon of the whole knee. Why does how you make this important movement daily? I'm gonna check also the other knee. I will start from the outside, which are some.
That is very,
Yeah,
that's very sharp.
sharp pain.
Yeah.
And how much pain would you say here?
This is the same as 9.
Okay.
It's really, it's like you can bruise and somebody touch the bruise.
Yes, that is because of the inflammation, chronic inflammation that is in there. Actually, this is the area where you can see that there is some swelling on the area.
Yeah.
This is the part of the peasant tendons. This is a group of tendons that comes from the muscles from the thigh. right? So these tendons are also affected with inflammation. I'm gonna check also part of the foot. Also painful, right? It's painful, maybe not that much, but it is painful. Some of the ANF devices that we work with, they have different categories and also different numbers because we work with different frequencies. As you remember, there is no medication nor kind of substances, only a frequency. So each of these categories is charged with a specific frequency. We will apply on the skin, but you will not feel the frequency. Don't be afraid of an electrical charge. No, that doesn't work. They are so subtle, so that you will not feel them. So you just will feel either the benefits directly or you will experience the deeper symptoms that will be difficult. Right? So these are some of them. I have chosen different categories and different types of frequencies depending on the tissue that we want to apply. I've seen that you have some body cream. Let's start using the pain and inflammation devices, for example, P200. I'm gonna create a protocol to cover the whole knee because we have different injuries on the knee. So first, I'm gonna put a positive on the patellar tendon. I will do also on the lateral side, the knee. The patella, medial side, here, and another positive. On the top of the patella, I'm going to apply and see. I will use also antioxidant carnosine. Antioxidant glutathione, and I will apply the negatives on the back. For that, I will need you to go just to turn face to go in your So here, that's me. Are you comfortable? Yes. Alright, so now what I'm gonna do is I'm gonna check again the same areas where you have that much inflammation from the beginning, and again you're gonna tell me how much pain do you have now with this palpation, alright? This is the first point here. I'm gonna get it down into the tendon. How is this now? No pain in this tendon, just slight pain, slight, right? Yeah. That was the patellar tendon that we palpated. Okay, so the next point, remember it was a important point here on the side, it was flat part. How much? It's about 5. 9.25. Good. Now we go to the tendons here. Sharp. Yeah, the sharp pain.
Yeah, it's nothing, to be honest. That's okay, that's fine. It's fine.
And then on the left side,
That's about 5, 6. Not much. I can push more. Yeah.
so now slowly let's try to bend the knee.
Just a pain, but not extreme.
So now you're able
But it's
to.
it's not.
This is what I mentioned before, that in this position we like to do intestines. But the ligament, I will be doing it. Okay. And now you can bend a little bit. Okay. So you feel comfortable here,
Yes,
right?
yeah.
Okay, so it seems that the therapy is working.
It's pure, honestly. I mean, it's a percentage.
Mhm.
That's amazing.
Mhm.
Just how long? 10 minutes now?
Yes, the time it took for you
Oh
to
my
drink the
God.
bottle of water. You drink faster.
I'm gonna drink lots of water. It's called I will do the outpatient.
We are happy that we can help. So now we are gonna, you can sit up. And let's repeat some of the movements. Okay, so first at the beginning, we sit down normally in this position and sit. And then let's start with the first movement. We're going to go the rocking.
That's amazing. Oh my God. Yeah, it's fine. Honestly, yeah, that's fine. That's amazing. That this is okay. It's not. I'm not putting pressure on my knees. Yeah, I'm speechless. I'm speechless, honestly. But this is perfect. That's it. Honestly. Yes, there's like 2%, but nothing.
And you're able to put one foot
Yes,
after the other.
yes, because I was scared at the beginning, thinking after the pressure, but now it's fine. Just a slight pain, which is nothing. Oh my God, oh my God, I don't know. It's a miracle. Honestly, it's just like,
And we are so happy to be able to help people and to help you.
thank you so much. Honestly, I've been in this pain, living with it for 5 weeks.
So now you know what is important for the ANF therapy to work. Water, lots of water.
Yes.
I'm gonna give you another bottle for home, and it's important that you drink water. So the devices they continue working on your injury. Okay. The devices are working 24 hours, 72 hours. They can work day and night.
What brings you today to the ANF Academy and ANF Clinic?
Well, I had a knee problem 5 weeks ago, which started with pain, and it just stopped me from practicing my day-to-day routine. I was exercising, going to the gym, swimming, doing my dancing lessons, and walking, coming up the stairs.
So you used to be very active.
Yeah, I'm very active. I could not do all that. Even walking, I could not do that.
But what happened?
Well, I have no clue what happened, but it just suddenly I felt my joint gonna split apart, and I thought sometimes we push the leg too much. I thought maybe something I did, but after that it was swollen. And
For how long?
It's 5 weeks now, so it's a long time.
Yeah.
And I tried everything; it did not work.
Did you try any other therapy?
I did try therapy. I tried physio. I tried cream. I tried painkillers. I tried everything. No, nothing happened. It's still the same. But today, the magic happened, and I'm speechless because a matter of, is it 5 minutes? Maybe less than 5 minutes. After feeling the pain with the examination and pressing on the sides, and I'm like, yes, I'm in pain, and I'm giving it 10 out of 10.
How would you rate your pain before you came and today after the therapy, after the treatment?
Before it was 10 out of 10, but now I say 2. It's amazing. I can walk normal, not limping. I managed to go up the stairs and down without like one leg, and I can bend my knee as well.
Would you recommend ANF therapy to your family and friends?
100%.